ধন্যবাদ স্যার। আমি আমার পরবর্তী প্রশ্নের জন্য ডাক্তার মাহমুদ সাজেদিন স্যারের কাছে যাব। স্যার, আপনার কাছ থেকে মূলত যেটা জানতে চাই, স্যার, মাড়ির শেপিং করতে কোনটা ভালো, গতানুগতিক অপারেশন নাকি স্যার লেজারের মাধ্যমে চিকিৎসা? ফর গাম কন্ট্রোলিং, হুইচ ইজ বেটার, কনভেনশনাল মেথড অর লেজার?
Before I answer this question, I want to thank Mr. Professor Balaji, Professor Ajay, Professor Bennete, and my friend Anupam Podder for giving us so knowledgeable informations about orthodontics, periodontics, and in the interrelation between these two. And it is a quite cold night today. The temperature of Dhaka is 17, but the discussion is quite warm. So thank you, everyone. So about this question, the conventional thing is good, but the laser is better. Better in that sense that laser offers bloodless surgery. Other than that, it is almost same. The after effects and results, these are almost same. So we can say that if you have the opportunity of using laser, you can do it, but the conventional system is also okay with it.
ধন্যবাদ স্যার। আমি আমার পরবর্তী প্রশ্নের জন্য ডাক্তার প্রফেসর ডাক্তার অজয় কুবাবাত স্যারের কাছে যেতে চাই। স্যার, in case of space closure, gingiva becomes folded. What should be the ideal protocol just after orthodontic treatment in such cases?
Very good question. See, there is quite a change in the way, I would not say young generation, but I would say contemporary orthodontic treatment has been done. With the advent of so many newer technology in orthodontics, like clear aligners, Invisalign, and there are so many adjunct, like nowadays, when we were younger, probably we were doing something which was biomechanically correct. And if we go through the talk of all these eminent speaker, Dr. Balaji, Monahar, Dr. Anupam, and as Dr. Bennete has also said, we have been trained in a way where we used to say, follow the KISS principle. That is, keep it simple, sir. So when you follow the KISS principle, probably, lighter the force, better the movement. And when we say better the movement, that means you are being very gentle to periodontium. Now, such problem happens when you are trying to, woo the patient by closing the space too fast. So when you try doing it, there would be definitely, there is a folding of the gingiva. And when such thing happens, first thing as an orthodontist, you should know that what is the rate at which you are closing the space, right? The second thing is, make sure that your forces are not too heavy on the periodontium. Ultimately, what will happen is you will close the space, you will woo the patient that I've finished your treatment too fast, right? I'm better than the other orthodontist, but at the expense of the periodontal health. So my suggestion would be to go, you be a little evidence-based, rationally you apply the force, and whenever needed, don't shy away from taking an advice as well as the intervention of a periodontist, as in when you feel that something is going wrong. Because if the folding has become, more than uncontrollable, probably patient will start having too much of bleeding, and you will have inflammatory process, which is contradictory for your orthodontic tooth movement. So my suggestion would be to follow the KISS principle. Keep it simple, sir.
So, Dr. Ajay, you say that it is better to be 1 month late rather than being 2 months early.
Exactly.
Yes.
Because there is a thin red line.
Thank you very much.
Sorry, because Dr. Balaji, there is a thin red line, that how much is too much.
Yes.
And that you learn only after, burning your fingers. So yes, it is better to be slow rather than, being in hurry, finishing now, but ending too soon for their prognosis.
Yes, because we do see some patients who come to college where the treatment has been done very fast and the teeth are really very mobile, and it is beyond our control also to save those teeth, because the forces have been applied too much and too fast. So it becomes a big problem.
Very true, sir. Thank you.
Dr.
Thank
Balaji
you,
sir.
Professor.
Sir.
Hello, Dr. Balaji sir.
Sir.
I would like to know about the POW procedure. Please tell this in this POW procedure.
POW procedure, sir, you also mentioned in your opening remark that it is a procedure which is being done to fasten the treatment, orthodontic treatment. You had said that it's taking almost like 1 year, 1.5 year treatment, which is being done. By doing this procedure, we are reducing the time period, maybe where if it was taking 1 year, probably it will get over in 9 months or 10 months time it will get over. Now, this is a very technique sensitive procedure, sir, because here we are reflecting the gums and we are trying to cut the bone, hard bone, so that the movement of the teeth can be taken faster than normal. Because when we are applying the orthodontic forces, there is, we all mentioned that there is a resorption of bone taking place. So that resorption of bone will take place only when the force is being applied. So by cutting the bone, we are actually making the bone little softer for the movement of the teeth to take place a little faster than required. So in between the teeth, there is bone present. So we use our instruments. Nowadays we use piezo surgical unit also, so that the bone can be cut in between, so that the movement can take place faster. But at the same time, when we are doing this, we know that the resorptive action of the bone is taking place. So bone is going to be lost at a much faster rate. So we have to compensate it. So for compensating it, we apply some bone graft material also in that, so that bone formation also takes place. So it has to be done in a very systematic manner. We cannot just go about cutting the bone here and there. It has to be evaluated properly. Radiographs have to be taken. Now, advanced diagnostics, we have the CBCTs are present. So we take CBCT also to check the amount of bone which is present, the thickness of bone which is present, so that accurately we may be able to give the cuttings in between the tooth surfaces, sir.